Basically, we see two types of travelers. The first set of travelers are those who are experienced with overseas travels, and basically they show up just for their vaccinations or immunizations. The more interesting group of patients we see are those people going overseas perhaps for the first time to a new destination and have unique questions about their itinerary or their health problems. There's basically three types or three categories of immunizations. The first type are those that are required for a traveler to enter a country. The most common is yellow fever vaccination. Another required vaccine is meningococcal when going to Mecca during the holidays. The second category of vaccinations is those that are recommended, and that's typically hepatitis vaccines, typhoid, updated polio, etc. The third category are those that are routine, that any individual, whether they're traveling or not, should be updated, and those include tetanus, pneumovax, shingles vaccine, and measles, mumps, rubella. A large concern of travelers, especially those going overseas, is malaria. There are malaria endemic areas throughout the world, and malaria can be fatal. Fortunately, it can be prevented with simple medications. These are available through prescription only in the United States. It's also recommended that a traveler obtain these medications here at home because the quality of these medications overseas sometimes is suspect. A much more common problem travelers will often encounter is diarrhea. With specific recommendations and medications, we can make your trip more enjoyable by giving good information to travelers before they exit the country. Other health problems depend upon an individual's itinerary. A common question is that of altitude sickness. Going to Peru and Machu Picchu is a common traveler's destination for vacation, and the altitude there is quite high. And it's not uncommon for travelers to have questions regarding prophylactic medications to reduce or eliminate the chance of altitude sickness, and oftentimes we can help reduce that risk as well.
First thing, we will go through the itineraries with them and find out the purpose of their trip, to find out where they're going to stay, and we will recommend the vaccinations for protecting them, and also find out if their childhood immunizations are up to date and the benefit and possible side effects of that vaccine or vaccines they are receiving. I will administer the vaccines. We will provide an international certificate of vaccination, and also if they want to have a prescription for malaria and antibiotics for traveler's diarrhea.
If a traveler encounters problems overseas, we like to prepare for that. During our consultation, we provide U.S. Embassy addresses and telephone numbers to the travelers of the countries on their itinerary. Second, patients who have established their care with a Saint Alphonsus physician, we facilitate them getting their electronic medical records via the internet through mysaintal's.com. Another program we're developing here at the Travel Medicine Clinic is an email address that travelers overseas could email us questions as they arise from anywhere in the world, and we would then help facilitate their medical care wherever they may be.